Wes Streeting, the new health secretary, has said that the NHS is experiencing its worst crisis in history, attributing this to 14 years of mismanagement and poor leadership, which have resulted in record waiting lists, declining patient satisfaction, incompetence, strikes. And he emphasises that Labour's plan is to address these issues by increasing the number of appointments, scans, operations weekly, particularly going through the evening and weekend sessions. Health isn't tied up to a working week. Additionally, Labour intends to double the number of diagnostic scanners to facilitate earlier diagnoses and faster treatments. There used to be a time when there was an out-of-work doctor, an out-of-work GP who would see you in the evenings or at weekends. Now, if you're ill, you have to go to A&E. This is an absurd use of funds when seeing somebody in A&E costs significantly more than being seen by a GP in a local GP surgery. We need to change the way things are done, which means we need to revise the effective privatisation of the GP surgeries. These things need to become more of a public service that they used to be. We need to go back. We need to put time back to an age when there was proper service, proper dedication to the public, and then move forward quickly into the 21st century. But in order to advance forward, we need to go back. And Streeting acknowledges the complexity of the NHS's problems, but simply acknowledging that something is complex doesn't necessarily solve it. But at least he isn't trying to produce a simple pat solution, which suggests that money is going to answer all the problems. You can throw as much money at the NHS as you want to, but until you get rid of and change the bureaucratic mess that dominates the NHS, like some sort of cloud or some sort of shitstorm, you can't repair the real working mechanics of the NHS system itself. You've got to get under the bonnet. You've got to take out a lot of these NHS trust managers who have no training, who have no background in real medicine, whose background is in moving pieces of paper around a desk, and who are barely literate, frankly. Labour's plans appear modest. They may be modest. They're designed to under-promise and over-deliver, contrasting with the Conservative Party's track record of over-promising and under-delivering. Labour plans to stabilise the NHS workforce, to implement national standards in social care, to improve the efficiency of funding allocation rather than merely increasing the budget. But unless Labour is prepared to deal with the institutional makeup of the NHS, this will again simply be a sticking plaster for a gaping wound. Regarding the negotiations with junior doctors, which Streeting is about to start, Labour's approach includes commitments to fair pay and improved working conditions. But I think that should come with an understanding that no bureaucrat is paid more on principle than a senior consultant. The people who are actually doing the work should be getting paid more than the people who are just pushing a pen around. And Streeting has indicated a willingness to confront challenges head on, including potential conflicts with NHS unions to achieve these reforms. And by the way, when I talk about pen pushers being paid less than the people who actually manage a scalpel, I speak as a pen pusher. And, as somebody committed to academic life, I don't believe that I should be paid more than somebody who is poised to save my life in a hospital. People who are surgeons and senior consultants should be paid more than pen pushers, by definition, by principle, and that isn't what happens in the NHS today. We need a reformation in the NHS, and it needs to start at the top with a clear out. The focus needs to be on reducing bureaucratic hurdles and ensuring that qualified medical staff are available where needed, increasing district nurses to support community care, increasing and prioritising the training of junior doctors, the training of nurses, the training of consultants, and to nurture and care for these people who in turn care for us. While ambitious, the Labour plans will require a little time. They will require significant effort from government, from the NHS, from the education system to implement effectively, and their success will depend heavily on Labour's ability to secure the necessary political and financial support to drive their changes forward. These are changes which should have been in place during the last 14 years, but they weren't. Instead, we stood on our doorstep and clapped. Simply absurd. Simply absurd.